The correlation between psychosis and Kundalini awakening. Kundalini awakening and psychosis are two phenomena that, although originating from vastly different frameworks, spiritual and psychological, share some overlapping characteristics that can be confusing to differentiate. Understanding how these two experiences intersect and diverge is essential for grasping the complexities of human consciousness and mental health. Kundalini awakening is rooted in Eastern spiritual traditions, particularly in Hinduism and yoga practices. It refers to the rising of an energy force, depicted as a coiled serpent at the base of the spine, which, when awakened, travels up through the body's chakras. This spiritual energy, once activated, is believed to lead to heightened states of awareness, spiritual enlightenment, and an expansion of consciousness. Those who experience a Kundalini awakening may report vivid dreams, visions, physical sensations such as heat or energy surges, and intense emotional experiences. Psychosis, on the other hand, is a mental state characterized by a loss of contact with reality. It often involves hallucinations, delusions, disordered thinking, and emotional disturbance. From a clinical perspective, psychosis is generally considered a symptom of mental health conditions like schizophrenia, bipolar disorder, or severe depression. It is viewed as a disintegration of the individual's perception of reality, often requiring medical treatment and intervention. Although Kundalini awakening is typically regarded as a spiritual experience, it can sometimes result in symptoms that resemble psychosis. During a Kundalini awakening, individuals may report feeling detached from reality, experiencing profound changes in perception, or encountering intense mental and emotional upheaval. These experiences, which are seen as part of a transformative spiritual process, can, at times, be mistaken for or overlap with psychotic symptoms. For instance, the sense of altered reality or hearing inner voices during a Kundalini awakening could be misinterpreted as a delusion or hallucination in a psychological context. The overlap between psychosis and Kundalini awakening can be further complicated by the intensity of the spiritual experience. A sudden or unplanned Kundalini awakening, especially in individuals unfamiliar with the process or unprepared for the changes it brings, can lead to overwhelming experiences that are difficult to manage. Such individuals may feel disoriented, fearful, or as though they are losing their grip on reality, symptoms that closely resemble those of psychosis. This raises an important question. How can one distinguish between a spiritual awakening like Kundalini and a psychotic episode? One key difference is the intention behind the experience. Kundalini awakening, when guided and understood, is often a deliberate pursuit, tied to spiritual growth and practices like meditation or yoga. Psychosis, however, is generally unintentional and is experienced as a disordered, frightening state of mind. Another distinction is the outcome of the experience. A Kundalini awakening, even if challenging, often leads to positive personal growth, greater awareness, and a sense of connection with the universe. It is seen as a journey towards spiritual enlightenment. Psychosis, in contrast, is typically destabilizing and disruptive to daily life, often requiring therapeutic intervention to restore balance. There is a growing interest in understanding the physiological and psychological mechanisms behind both phenomena. Some researchers propose that the intensity of Kundalini awakenings might trigger latent psychological issues, or exacerbate underlying mental health conditions, such as schizophrenia or bipolar disorder. In this view, what appears to be a Kundalini awakening could, for some individuals, be an expression of an underlying mental health condition. This is particularly relevant in cases where individuals report severe disturbances following their spiritual practice. However, many practitioners of Kundalini yoga and Eastern spiritual traditions argue that, when properly managed, a Kundalini awakening is not a mental health crisis but a profound spiritual transformation. They advocate for careful guidance, preparation, and support for those undergoing this process to avoid potential negative outcomes. Without a knowledgeable guide or a structured practice, individuals may struggle to integrate their experience, leading to confusion and distress that can resemble psychosis. Furthermore, the context in which these experiences are understood plays a significant role in shaping how they are interpreted. In Western psychology, an altered state of consciousness is often viewed through the lens of pathology, whereas in spiritual traditions, it may be seen as a natural, even desirable, part of spiritual evolution. This cultural difference can lead to misinterpretations of Kundalini experiences as mental health crises, or alternatively, to spiritual experiences being dismissed or overlooked in clinical settings. While some argue that the overlap between psychosis and Kundalini awakening is due to the complexity of human consciousness and brain functioning, others believe that the two are fundamentally different phenomena that simply share outward similarities. Those who embrace a more spiritual perspective might view psychosis as an energetic or spiritual crisis that could, under the right circumstances, lead to a positive transformation. Conversely, from a medical viewpoint, psychosis remains a disorder requiring clinical attention. In summary, the relationship between psychosis and Kundalini awakening is a complex one, and careful consideration is needed to differentiate between the two. While both involve altered states of consciousness, they arise from different sources and are typically framed differently. Psychosis as a mental health condition and Kundalini awakening as a spiritual process. However, the intensity of a Kundalini experience can sometimes resemble psychosis, particularly if it is unexpected or unmanaged. Proper guidance and support, whether from a spiritual or clinical perspective, are crucial in helping individuals navigate these experiences and ensure their well-being. Whether viewed through a spiritual or psychological lens, understanding the nuances of these experiences can provide valuable insights into the nature of consciousness, mental health, and personal transformation.